Hey guys, welcome back to my channel, and if you're new here, my name is Kristina. In my videos, I talk about a plant-based diet and nursing school. If you like these types of videos, please like this video and subscribe down below. In today's video, I'm going to be talking to you about the HESI exam, specifically the Fundamentals of Nursing or Foundations of Nursing exam in particular. So let's get into it. So this exam, I had to take my first semester of nursing school because I took the class Foundations of Nursing. So not all schools require you to take HESI, it's just in particular what schools require HESI or which school requires to take ATI. So my school, they only do HESI exams. Every semester we have to take at least one, and my first semester we had to take, like I said, the Foundations or Fundamentals HESI exam. For those of you who haven't taken any HESI exams before, they're not like your typical standard test that you would have in class. Particularly, it really depends on your professor, but for me it felt a lot different. There are more like scenario situations, and while we had some of those in class, these were kind of like every question was like a scenario. So you had to know safety, you had to know like the material really well in order to answer the questions. For every school, it varies how your teacher incorporates the HESI exam score into your overall course grade. So for some schools, I heard that you either get like a pass or a fail. Other schools, you have to make a certain score and then it's converted into like a percentage, and I'll get into exactly what that means. So for my school, it counted as 20% of our grade, so we had a big incentive to do well on the exam, because if you didn't, then it could either like bring your grade down or you couldn't like pass for the whole semester. So it was a big incentive to do well, and I want you all to do well as well. So for example, let's say you get an 800 on your HESI exam and then someone else gets an 822. So the person who gets an 800 gets a conversion score of, let's say, a 79%, and the one who gets a 820 gets a conversion score of a 78%. And you're like, how is that possible? The person who just got an 820 gets a lower score than the person who scored an 800. Well, it depends on how the HESI determines which are the difficult questions and which are the easier questions. So if you have the person who gets the 820 but has all these easy questions that they're getting right, but the harder questions, they're getting them wrong, then the person who gets the 800 is getting the more difficult questions right. They're actually getting the higher conversion score. So it really depends on which questions you get and how the HESI determines what your overall score will be. So that is basically the conversion scoring method, and typically it depends on which HESI you get, but the ranges are typically from 750 to 1,000. In some HESI exams, you can get up to 1,500. It's not as common, but there are definitely people who get that high. So for the actual exam, my advice on how to study for it, I use this book right here. So this is the HESI Comprehensive Review, NCLEX to RN exam, and mine's the edition 6. So basically, first thing what I did was, when you open the book, it has, you know, HESI Scratch Gentle Reveal to code. So you get the code inside the book, and you go on their website, and basically they provide you with extra questions on the material that you're about to go over in the book. So at first I was like, oh, there's nothing related to this first test in here, but there actually is. It's just a little bit harder to find. So you have to go to the very beginning portion of the book. It goes over like test taking strategies and tips, and if you have trouble taking tests, this is a really good page, few pages to read about. It tells you about like strategies on how to take a test, HESI hints, and also it goes over the information that the Foundations exam or Fundamentals exams you would see on your normal test. So it tells you to identify keywords, how questions are asked, and what sort of things to watch out for. So it's actually telling you like how to answer their questions, which is awesome, because no other resource is really going to show you that, especially if you learn it from in class and stuff. It doesn't really go over that info. So it says HESI hint. Most questions are written in a positive style. So you want to see like which question you could eliminate certain things if it's not written in a certain way. It goes over the nursing processes, what you'll need to know based off that. So if you're having trouble learning about like ADPI and which one to do first, it gives you examples as far as what to go over, what a nursing diagnosis is, and everything about safety and critical thinking skills. You really need to know what to look for in the questions when it says you have 4 different patients, which one to see first. Those are priority questions. So if you just Google priority questions for nursing school, then you could find other videos and resources about like which patient you would go see first. Those really helped me because some of them are really tricky. Like they'll be like, go check on a patient whose O2 stat is 90%. And then you have another one that's like a patient comes in and has their airway is restricted by an object that was swallowed or something like that. Obviously, you would go see the patient who has their airway obstructed versus someone whose O2 level is a little bit declined, because it goes in order. So airway, breathing, circulation. So really drill those into your head. I don't know if your teacher goes over in detail about each one is, but there's a big difference between in-class tests and the HESI exam, because in class, those tests are really detailed and specific to the certain material that you need to know for taking your test. But then the HESI exam is really specific to what they want you to know. Some things that you really need to know for the HESI exam are as follows. Number 1 is safety. The HESI exam loves to ask questions about safety. I definitely recommend is to go over what is the safest way to take care of a patient. A lot of the answer choices I noticed were the safest option. So you want to think clearly about what is the safest measure that you can take to help a patient. So let's say you walk into a patient's room and you have the options, you see them and their O2 stat is at 73%. What is the safest thing that you can do to help that patient? Is it to put on a nasal cannula? Is it to raise the head of the bed? Is it to put down a trach? Or is it to give them a medication? At first you might think, oh, let me just put on the nasal cannula because they can't breathe that well. But what is the first thing that you would do? All you have to do is raise that head of the bed, because you're giving them more oxygen just by positioning them differently. If they're laying supine, they can't get enough oxygen, but if they're reclined up in either semi-Fowler's or Fowler's position, it helps them breathe better. So those are some simple things that you may not think of, but it just takes a little effort to like read about what the HESI wants you to know and how you can pass. Another thing that I recommend to absolutely go over is Maslow's hierarchy. There are plenty of videos on YouTube about different ways to remember the like pyramid steps and which falls under which category. So you need to know that like the back of your hand, because those will help you with like half the questions. Anytime you have a question, I literally was like picturing that in my head and trying to figure out what is the priority, who is the priority. There are certain situations that it might just be like a safety thing that is involved with Maslow's, that you have to take care of a patient's safety prior to any of the other ones. So definitely know that really well. Another thing that I recommend going over is the nursing process. So as I said before, it's ADPI. So you need to know what each segment of that and what it means. So in this book, if you do have it, it tells you assessment, nursing diagnosis, planning, implementation, evaluation. You need to know those, because there's certain questions that's literally just like, what would you do first again? And it'll say like different things. It might say evaluate or implement. It'll literally say like auscultate, and you have to determine which one you will do first. So of course you want to assess the patient first before you start implementing something, because you need to know what's going on with the patient before you could actually implement anything or evaluate anything. So really read the questions when they're asking you those specifics, and that should really help you. Another thing that I recommend is to know your electrolytes levels. So you really want to know the ranges. There's not that many questions on it, but it's just important to know the standard ones. So like sodium, potassium, chloride, and magnesium. Like those 4 are like the most common ones that you would probably see. Another thing that I would recommend going over is to know the different laws and regulations that we as nurses are able to do. So what I mean by that is you need to know what you can do and what you can't do. So there are certain rules between an RN, an LPN, and like a CNA or someone who helps or aids the nurse. So those you need to really like make a chart and try and determine what things that can you do and what things can an LPN do, because LPNs actually can do a lot. There's just a few things that they can't do. So make sure that you know and you can distinguish between the two, because sometimes they'll give you select all but apply, and if you don't know 1 or 2, it could really mess you up. So that's definitely an easy question that you can get right, as long as you, again, you study the right material. Going further with the laws and regulations, you want to know the different laws that are in place for us nurses. For example, there's the Good Samaritan Act, where if a nurse sees a patient lying on the floor, then we can perform CPR and not get in trouble if, God forbid, something happened to the patient. They can't say that it was our fault and we shouldn't have done it. As a Good Samaritan, as trying to be a good nurse, that is our duty and our job to see someone outside of work and to go aid them. So they have that law in place, which I think is awesome, but you need to know it. Also, you want to know the different terminology when it comes to assault, battery. There's also a few others in here: invasion of privacy, false imprisonment, fraud. You need to know those because there's like maybe 1 or 2 questions that you might have that will go over that. So I definitely recommend reading about that. Just try to go through this and see what sort of things have come up on my exam. There's another question on there that I particularly had where it went over like time management, and it was like basically saying the charge nurse needed to figure out a schedule, and they were trying to see what sort of things would the nurse manager take into account. So one of them was like, if the staff wanted to work certain times, if they had a preference, or who wanted to work certain days, something like that. So you just need to know like what sort of things would fall under that. And it does have a section in this book where on page 14, if anyone that does have this, you can look into that as well. But there's, what I really like about this book, it has HESI hints in it. So it tells you different hints that you would need to know for the exam, and these are like the best things to read if you need to, if you're like, oh, I'm not going to read the whole book, I'm not going to do all that, just read those hints, because that will help you with a ton of questions. I'm not saying that's all you need to do to pass this exam, because it's definitely not. You actually do need to study for it. So there's like a HESI hint that says assertive communication starts with I need rather than with you must. So you never want to go to a patient and say, you must take this medication every single day for the next week. You would say, I need you to look at this medication and take this every single day for the next week so that you can get better. It helps with your high blood pressure, and then you would go over into like what sort of things they need to do versus forcing them, saying you must. So it's a different approach, it's more therapeutic. That's another thing where it brings me to therapeutic communication, which this book doesn't touch too much on, but you definitely need to go over it with your notes or any other resources online. You need to know how to speak to the patients. For some people, it's really easy to figure out, but for me, I have some trouble figuring out the questions because some of there's always 2 answers that I feel like you could eliminate easily, but then you have the other 2 answers that sound therapeutic, but there's that one little thing that could make or break the question. So typically you can narrow it down to 2 answer choices, but then I'm kind of like stuck with answering between these 2 and not really sure what to do next. So what I do is I look at it and I look at the verbiage that they use. So typically one of them says why in it and the other one says tell. The one that says tell or tell me is typically the answer. The one that says why, the HESI, for whatever reason, considers it not as therapeutic as tell me. So that is definitely a HESI hint for you. Another thing that I suggest you to review is about how to help a patient with, like, let's say they get crutches or a walker, those sort of aids and guides that they have for the patients. You need to be able to discuss to a patient how to use them. So the HESI does have 1 or 2 questions on that. For me, I believe it was on crutches. So you need to know the different forms of how to use a crutch. So you know that it's like the tripod format, or they have like the different formats on how to use the crutches properly. Another thing that I would look out for is those sort of questions that say you have a temperature of X, you have an O2 stat of this, BP of this, and heart rate of this, and you have respirations of this. So you have one of those scenarios where it just gives you all that information and it says which one would you need to take action upon. So you need to know your ranges for all of them, because if you don't know your vital sign ranges, then you can't figure out the answer to the problem, and that's like an easy question that you could get right. The last thing that you should do is to go online and to look at the questions that come with the book. So you have to like go onto their website and then you put in the code and then it will give you a pop-up to questions. Then you have to go in there and look up foundations or fundamentals subtopic, and it will give you about 150 questions on this material. So really learn the material and then go back in to take the questions, because they only have 150 and then that's it. While you're doing those questions, it is super important that you look at the rationales. So if you get an answer wrong, or even if you get it right, I recommend you reading why it is right or why it is wrong, because those really helped me personally, because some of them you would think that like, oh, it's right for this reason, but it's really something completely different. It's related to ABCs or Maslow's, and you really want to make sure that you know why you got it right or why you got it wrong for future questions. The last thing that I recommend is to look at the Saunders book. So there's this Saunders book that I mentioned in one of my previous videos, and that book has extra material to go over. Now those questions are a lot harder and definitely involve more cognitive thinking, but it really helps that when you take the HESI, that these questions on the HESI exam seem a lot easier than the Saunders one. So the Saunders one has an app, and I will show it down below, or I'll link it up here, and you can look at that, and that's completely free. You don't even need to like pay for anything. So don't pay for anything, don't even sign up, just go in the app for free and look under foundations or fundamentals, same sort of thing as HESI. They're by the same makers, but for some reason those questions are harder. I think it's geared more specifically to the NCLEX, but it's super helpful to know that information on both ends. So if you want something a little bit harder because you want more questions to answer, that will definitely help, and they have rationales there as well, and I will be glad to help. I hope you guys liked this video. If you did, please like this video and subscribe down below. Like always, if you have any questions, feel free to comment down below, send me a DM on Instagram or anything like that, and I'll be glad to answer your questions. I hope to see you guys next time. Bye!